multiple sclerosis. Multiple sclerosis or MS is a potentially disabling disease of the brain and spinal cord, that is central nervous system. In MS, the immune system attacks the protective sheath, that is myelin, that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause permanent damage or deterioration of the nerves. Signs and symptoms of MS vary widely and depend on the amount of nerve damage and which nerves are affected. Some people with severe MS may lose the ability to walk independently or at all, while others may experience long periods of remission without any new symptoms. There is no cure for multiple sclerosis. However, treatments can help speed recovery from attacks, modify the course of the disease, and manage symptoms. Earlier on this channel, I have already uploaded a short video about multiple sclerosis. I hope you have already seen that, and today I am going to discuss this illness and detail and various treatment options for this. Okay, first of all, let me tell you the symptoms. Multiple sclerosis signs and symptoms may differ greatly from person to person and over the course of the disease depending on the location of the affected nerve fibers. Symptoms often affect movements such as numbness or weakness in one or more limbs that typically occurs on one side of your body at a time, or your legs and trunk. Second symptom is electric shock sensation that occur with certain neck movements, especially bending the neck forward. This is known as Learmit sign. Okay. Then another symptoms could be tremor, lack of coordination, or unsteady gait. Vision problems are also common, including partial or complete loss of vision, usually in one eye at a time, often with pain during eye movement. Prolonged double vision, blurry vision can also occur. Multiple sclerosis symptoms may also include slurred speech, fatigue, dizziness, tingling or pain in parts of your body, problems with sexual, bowel and bladder function. You should see your doctor if you experience any of the symptoms which I have just told you for unknown reason. Okay. If symptoms are not related to any other illness, if these symptoms occur due to unknown reasons, then you should consult your doctor immediately, okay? Because you may be suffering from multiple sclerosis, okay? Now I'll tell you a little bit about the disease course. Most people with MS have a relapsing remitting disease course. They experience periods of new symptoms or relapses that develop over days or weeks and usually improve partially or completely. These relapses are followed by quiet periods of disease remission that can last months or even years. Small increases in body temperature can temporarily worsen signs and symptoms of MS, but these are not considered true disease relapses. At least 50% of those with relapsing remitting multiple sclerosis eventually develop a steady progression of symptoms, with or without periods of remission, within 10 to 20 years from the disease onset. This is known as secondary progressive multiple sclerosis. The worsening of the symptom usually includes problems with mobility and gait. The rate of disease progression varies greatly among people with secondary progressive multiple sclerosis. Some people with MS experience a gradual onset and steady progression of signs and symptoms without any relapses. This is known as primary progressive multiple sclerosis. Okay. I have discussed the types, and now I will tell you the causes. The cause of multiple sclerosis is unknown. It is considered an autoimmune disease in which the body's immune system attacks its own tissues. In the case of MS, this immune system malfunction destroys the fatty substance that coats and protects nerve fibers in the brain and spinal cord, that is known as myelin. Myelin can be compared to the insulation coating on electrical wires. When the protective myelin is damaged and the nerve fiber is exposed, the messages that travel along that nerve fiber may be slowed or blocked. It is not clear why MS develops in some people and not others. A combination of genetic and environmental factors appears to be responsible. Now I'll tell you some of the risk factors which are associated with this illness. Okay. The first is age. MS can occur at any age, but onset usually occurs around 20 and 40 years of age. However, younger and older people can be affected. Sex. Women are more than 2 to 3 times as likely as men are to have relapsing remitting multiple sclerosis. Family history. If one of your parents or siblings has had multiple sclerosis, you are at high risk of developing the disease. Certain infections. A variety of viruses have been linked to multiple sclerosis, including Epstein-Barr virus, the virus that causes infectious mononucleosis. Well, another name for infectious mononucleosis is kissing disease. There is already a video about kissing disease on this channel. If you haven't seen that video, you can see that is very informative. The link will appear in the I button. Okay. Then another risk factor is race. White people, particularly those of Northern European descent, are at highest risk of developing multiple sclerosis. People of Asian, African, or Native American descent have the lowest risk. Climate. MS is far more common in countries with temperate climates, including Canada, the northern United States, New Zealand, Southeastern Australia, and Europe. Vitamin D. Having low levels of vitamin D and low exposure to sunlight is associated with the greater risk of multiple sclerosis. Certain autoimmune diseases. You have a slightly higher risk of developing multiple sclerosis if you have other autoimmune disorders such as thyroid disease, pernicious anemia, psoriasis, type 1 diabetes, or inflammatory bowel disease. Another risk factor is smoking. Smokers who experience an initial event of symptoms that may signal MS are more likely than non-smokers to develop a second event that confirms the relapsing remitting multiple sclerosis. Now I'll tell you some complications of this illness. Well, people with multiple sclerosis may also develop muscle stiffness or spasm, paralysis typically in the legs, problems with bladder, bowel, or sexual function, mental changes such as forgetfulness or mood swings, depression, epilepsy. There is a video about epilepsy on this channel that is also available to watch, and that is very informative. You can see that video. Okay. Now I'll tell you how we diagnose multiple sclerosis patients. Well, when patients come to us, there are no specific tests for multiple sclerosis. Instead, a diagnosis of multiple sclerosis often relies on ruling out other conditions that might produce similar signs and symptoms, known as differential diagnosis. We really, most of the time, we will start with the thorough medical history and examination. That is very, very important, because most of the time the history and examination gives important clues about multiple sclerosis. Okay. Then, of course, we may recommend some blood tests to help rule out other diseases with symptoms similar to MS. Tests to check for specific biomarkers associated with multiple sclerosis are currently under development and may also aid in diagnosing the illness. Okay. Then we can also carry out spinal tap, that is lumbar puncture, in which a small sample of cerebrospinal fluid is removed from your spinal canal for laboratory analysis. This sample can show abnormalities in antibodies that are associated with MS. A spinal tap can also help rule out infections and other conditions with symptoms similar to MS. MRI, well, this is an important test, as you can see in the images. Well, MRI can reveal areas of multiple sclerosis lesions on your brain and spinal cord. You may receive an intravenous injection of a contrast material to highlight lesions that indicate your disease in active phase. Evoked potential test, which records the electrical signals produced by your nervous system in response to stimuli. An evoked potential test may use visual stimuli or electrical stimuli. In these tests, you watch a moving visual pattern, or short electrical impulses are applied to nerves in your legs or arms. Electrodes measure how quickly the information travels down your nerve pathways. In most people with relapsing remitting multiple sclerosis, the diagnosis is fairly straightforward and based on a pattern of symptoms consistent with the disease and confirmed by brain imaging scans such as MRI. Diagnosing MS can be more difficult in people with unusual symptoms or progressive disease. In these cases, further testing with spinal fluid analysis, evoked potential, and additional imaging may be needed. Well, now I'll discuss the treatment. Well, this is a this is a very long topic, and I hope you bear with me, because I have to tell you some important new developments in the pharmaceutical category to treat this illness. Okay. Well, actually, there is no cure for multiple sclerosis. Treatment typically focuses on speeding recovery from attacks, slowing the progression of the disease, and managing MS symptoms. Some people have such mild symptoms that no treatment is necessary. First of all, I'll tell you the treatment for MS attacks. The first important treatment is corticosteroids such as oral prednisolone and intravenous methylprednisolone are prescribed to reduce nerve inflammation. Side effects may include insomnia, increased blood pressure, increased blood glucose, mood swings, and fluid retention. Then there is the option of plasma exchange, also known as plasmapheresis. The liquid portion of part of your blood, that is plasma, is removed and separated from your blood cells. The blood cells are then mixed with a protein solution, that is albumin, and put back into your body. Plasma exchange may be used if your symptoms are new, severe, and have not responded to steroids. Now I will tell you about treatment to modify progression of illness. Well, for primary progressive MS, ocrelizumab, that is come with the name of Ocrevus, is the only FDA-approved disease-modifying therapy. Those who receive this treatment are slightly less likely to progress than those who are untreated. For relapsing remitting multiple sclerosis, several disease-modifying therapies are available. Much of the immune response associated with MS occurs in early stages of the disease. Aggressive treatment with these medications as early as possible can lower the relapse rates, slow the formation of new lesions, and potentially reduce risk of brain atrophy and disability accumulation. Many of the disease-modifying therapies used to treat MS carry significant health risks. Selecting the right therapy for you will depend on careful consideration of many factors, including duration and severity of the disease, effectiveness of previous MS treatments, other health issues, cost, and childbearing status. Treatment options for relapsing remitting multiple sclerosis include injectable and oral medications. Injectable treatments include interferon beta medication. These drugs are among the most commonly prescribed medication to treat MS. They are injected under the skin or into the muscle and can reduce the frequency and severity of relapses. Side effects of interferon may include flu-like symptoms and injection site reactions. You will need blood tests to monitor your liver enzyme because liver damage is a possible side effect of interferon use. People taking interferon may develop neutralizing antibodies that can reduce drug effectiveness. Then another injectable treatment is glatiramer acetate that comes with the name of Copaxone. This medication may help block your immune system attack on myelin and must be injected beneath the skin. Side effects may include skin irritation at the injection site. Then there are oral treatment options. First of all, I'll tell you about fingolimod, that comes with the name of Gilenya. This once daily oral medication reduces relapse rates. You will need to have your heart rate and blood pressure monitored for 6 hours after the first dose because your heartbeat may be slowed. Other side effects include rare serious infection, headaches, high blood pressure, and blurred vision. Then the next oral drug is dimethyl fumarate that comes with the name of Tacifidera. This twice daily oral medication can reduce relapses. Side effects may include flushing, diarrhea, nausea, and lowered white blood cell count. This drug requires blood test monitoring on a regular basis. Then the next drug is diroximel fumarate, and that is available with the trade name of Vumerity. This twice daily capsule is similar to dimethyl fumarate but typically causes fewer side effects. It is approved for the treatment of relapsing forms of multiple sclerosis. Then the next comes teriflunomide that comes with the name of Obagio. This once daily oral medication can reduce relapse rate, and this can cause liver damage, hair loss, and other side effects. This drug is associated with birth defects when taken by both men and women. Therefore, use contraception when taking this medication and for up to 2 years afterward. Couples who wish to become pregnant could talk to their doctor about ways to speed elimination of the drug from the body. This drug requires blood test monitoring on a regular basis. Then the next drug is siponimod that comes with the name of Mayzent. Research shows that this once daily oral medication can reduce relapse rate and help slow progression of MS. It is also approved for secondary progressive multiple sclerosis. Possible side effects include viral infection, liver problems, and low white blood cell count. Other possible side effects include changes in heart rate, headaches, and vision problems. Siponimod is harmful to a developing fetus, so women who may become pregnant should use contraception when taking this medication and for 10 days after stopping the medication. Some might need to have the heart rate and blood pressure monitored for 6 hours after the first dose. This drug requires blood test monitoring on a regular basis. Then the next drug is cladribine, that is available with the name of Mavenclad. This medication is generally prescribed as a second-line treatment for those with relapsing remitting multiple sclerosis. It was also approved for secondary progressive MS. It is given in 2 treatment courses spread over a 2-week period over the course of 2 years. Side effects include upper respiratory infections, headaches, tumors, serious infections, and reduced levels of white blood cell count. People who have active chronic infections or cancer should not take this drug, nor should women who are pregnant or breastfeeding. Men and women should use contraception when taking this medication and for the following 6 months. You may need monitoring with blood tests while taking this medicine known as cladribine. Okay. Now I'll tell you about some infusion treatments. The first is ocrelizumab, Ocrevus. This immunized monoclonal antibody medication is the only disease-modifying therapy approved by the FDA to treat both the relapsed remitting and primary progressive form of multiple sclerosis. Clinical trials show that it reduces relapse rate in relapsing disease and slowed worsening of the disability in both forms of disease. Ocrelizumab is given via an intravenous infusion by a medical professional. Infusion-related side effects may include irritation at the injection site, low blood pressure, a fever, and nausea, among others. Some people may not be able to take ocrelizumab, including those with the hepatitis B infection. Ocrelizumab may also increase the risk of infection and some types of cancer, particularly breast cancer. The next drug is natalizumab, that comes with the name of Tisabri. This medication is designed to block the movement of potentially damaging immune cells from your bloodstream to your brain and spinal cord. It may be considered a first-line treatment for some people with severe MS or as a second-line treatment in others. This medication increases the risk of potentially serious viral infection of the brain called progressive multifocal leukoencephalopathy, that is PML, in people who are positive for antibody to the causative agent of PML-JC virus. People who don't have the antibodies have extremely low risk of PML. Okay. Then the next drug is alemtuzumab, that comes with the name of Lantrate. This drug helps reduce relapses of MS by targeting a protein on the surface of immune cells and depleting white blood cells. This fact can limit potential nerve damage caused by the white blood cells, but it also increases the risk of infections and autoimmune disorders, including a high risk of thyroid autoimmune disease and rare immune-mediated kidney disease. Treatment with this drug involves 5 consecutive days of drug infusions followed by another 3 days of infusions a year later. Infusion reactions are common with this drug. This drug is only available from registered providers, and people treated with the drug must be registered in a special drug safety monitoring program. Alemtuzumab is usually recommended for those with aggressive multiple sclerosis or as second-line treatment for patients who failed another multiple sclerosis medication. Then we can also discuss some treatments for MS signs and symptoms, such as physical therapy for multiple sclerosis. Physical therapy can build muscle strength and ease some of the symptoms of multiple sclerosis. A physical or occupational therapist can teach you stretching and strengthening exercises and show you how to use devices to make it easier to perform daily tasks. Physical therapy, along with the use of mobility aid when necessary, can also help manage leg weakness and other gait problems often associated with MS. Muscle relaxants. You may experience painful or uncontrollable muscle stiffness or spasm, particularly in your legs. Muscle relaxants such as paclofan, tizanidine may help. Botulinum toxin treatment is another option in those with spasticity. Okay. Then there are medications to reduce fatigue. Mantadine and methylphenidate, that is available with the name of Ritalin, may be helpful in reducing MS-related fatigue. Some drugs used to treat depression, including selective serotonin reuptake inhibitors, may be recommended. Medication to increase walking speed. Well, there is a drug known as dalfampyridine that comes with the name of Ampyra, may help to slightly increase walking speed in some people. People with a history of seizures or kidney dysfunction should not take this medication. Other medications also may be prescribed for depression, pain, sexual dysfunction, insomnia, and bladder or bowel control problems that are associated with MS. Now I'll tell you about some lifestyle and home remedies to help relieve the signs and symptoms of MS. Try to get plenty of rest. Look at your sleep habits to make sure you are getting the best possible sleep. To make sure you are getting enough sleep, you may need to be evaluated and possibly treated for sleep disorders such as obstructive sleep apnea. Exercise. If you have mild to moderate MS, regular exercises can help improve your strength, muscle tone, balance, and coordination. Swimming or other water exercises are good options if you are bothered by heat. Other types of mild to moderate exercise recommended for people with MS include walking, stretching, low impact aerobics, stationary bicycling, and yoga and tai chi. Cool down. MS symptoms often worsen when the body temperature rises in some people with MS. Avoid exposure to heat and using devices such as cooling scarves or vests can be helpful. Eat a balanced diet. Since there is a little evidence to support a particular diet, experts recommend a generally healthy diet. Some research suggests that vitamin D may have potential benefit for people with MS. Relieve stress. Stress may trigger or worsen your signs and symptoms. Yoga, tai chi, massage, meditation, or deep breathing may help. Now I'll tell you some about alternative medicine. Well, many people with MS use a variety of alternative or complementary treatments or both to help manage their symptoms such as fatigue and muscle pain. Activities such as exercise, meditation, yoga, massage, eating a healthier diet, acupuncture, and relaxation techniques may help boost overall mental and physical well-being. But there are few studies to back up their use in managing symptoms of MS. According to guidelines from the American Academy of Neurology, research strongly indicates that oral cannabis extract, that is OCE, may improve symptoms of muscle spasticity and pain. And there is a lack of evidence that cannabis in any form is effective in managing other MS symptoms. Daily intake of vitamin D3 of 2000 to 5000 international units is recommended in those with multiple sclerosis. The connection between vitamin D and MS is supported by the association with exposure to sunlight and the risk of MS. Well, this was my video about multiple sclerosis. I hope you like this video. If you have any question about multiple sclerosis, or if you want me to upload another video about any illness, for that video is already not there. You can post your suggestion in the comment section, and as soon as I get time, I'll try to upload a video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.